schematics. Dr. Buford, we're just getting started on your left shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. And it's hard to see right now at the top here. Turn the pump on, please. Because the rotator...
Pause.
Okay, so we can see here the biceps is actually this structure that's torn. And when it's torn this much, you can't really repair it here. So we're going to release it because it does cause a lot of pain. And so this is what's called a biceps tenotomy. And oftentimes we can just use our shaver to do this. Sometimes we use a pair of scissors, but when it's torn this much, a lot of times our shaver is just as quick. Okay, so we'll get this released and show you some more in just a minute. Okay, so the biceps has been released, just wanted to show you. And then as we look around inside the joint, rotate me down. You can see you've got some irregularity in the humeral head above and in the glenoid down below. That's basically what arthritis looks like. Got a little bit of arthritis inside the joint, which is not unexpected. As we look here towards the back of the shoulder, this anatomy actually looks reasonable. Okay, and then we'll come up and look at this big tear in the rotator cuff tendon, which is right here at the top of the screen. So we're going to be doing most of our work on the rotator cuff. So we'll go off on the video for the moment and change positions with your shoulder here. Pause. Okay, so we've got a pretty bad tear here. It's torn in a bunch of different ways, really, this rotator cuff tendon. And we're just trying to clean up the edges to get back to something that's repairable. So as we look down here, what I'm cleaning off here is the bone that we're going to be reattaching the tendon down to. And then as you look out here, you can see this all is part of this delaminated split. So the first thing we're going to do is actually take a spinal needle and check and see an angle, a good angle to place a suture anchor down. And it looks like if we our first anchor back here, that would be a good spot. We'll make a little nick in the skin with a scalpel and place our first anchor down right here. So there's our guide. Just want to check to make sure we're getting all the way back as far as we can. Looks like we'll place our first anchor right about here. That down in the bone. And we'll pull back on it and make sure we have a good hold. Pretty solid. Okay, so now we'll take a crochet hook and reach in from the left side of the screen. We'll spread these sutures apart and decide what order we're going to use them in. get the partner suture, and then we're going to tie this knot, which will give us a good posterior anchor point. We'll get this tied and show you some more in a minute. Pause, please. Okay, so we've tied the first suture. We'll show you that in a minute. And now we're going to tie the next one. I want to get this solid blue one right here. And then we'll show you, you can see the knot we've already tied there in the back. So we'll go ahead and place in another suture hook here. Take a grasper. Not really in great shape. Really can't do anything to that to affect the quality. We can just try and get this down to the bone so it'll heal. Underneath again. Okay, we'll get that loaded and show you some a little bit. Okay, we've got the first two sutures from the first anchor tied. Now we're going to get this black and white striped one and decide how we're going to pass this. You can see we've got this split in the tendon here. So I really want to try and fashion a stitch that closes this gap in this split. So I really want to try and get underneath there and grab it. Okay, we'll get this done. Show you some more a little bit. Pause. Okay, so we've now, let me see the guide. We've now passed and tied all three sutures from the first anchor, and you can see how that's really helped us in the back here. I'm going to put the shaver in and clean up a little bit, then we're going to place another suture anchor. Pause. Okay, this is the second set of three sutures that we're going to be using. So this is from the second anchor that we've just placed. We're going to start with this blue and white striped one. Make sure I'm getting deep layer. Show you some more in just a minute. Pause, please. Okay, now we're going to tie these last three sutures now that we've got them all passed. We're going to do it one at a time here. We're going to start with the blue and white one. You can see how that's lined up there. Finish these knots and show you in a little bit. Sutures, that little area there that looks a little bit rough, that's just from the delamination in the tendon. So this actually looks really good. We've got it repaired back to the bone with 6 stitches, 2 anchors, and I'm going to finish up here and get you back to the recovery room shortly. So good luck to you now. Bye-bye.